Ever wish those surgical journals came with a little more excitement? You're in the right place. We're doing a deep dive today
Deep dive, I like it.
into equine laryngeal paralysis, specifically a technique that's, well, pretty revolutionary.
It's definitely become the go-to for many cases.
Unilateral laser ventriculocordectomy.
Catchy, right.
We'll stick with VC for short if you don't mind.
Works for me.
We're looking at a 2024 study.
From the Equine Veterinary Journal, really interesting stuff.
Even if you've seen a larynx or 2 or 100.
This one's got some real gems. Ready to get into it?
Absolutely. Let's make sure everyone's up to speed first, though. Recurrent laryngeal neuropathy, RLN as most know it. Big impact on performance. But for those who don't see these cases daily, what's the big deal with RLN? Why does it matter so much for these equine athletes?
It's more than just a hoarse voice, right? That nerve, the recurrent laryngeal nerve, it's a long and winding one. When it's not working properly, it affects the horse's breathing.
Especially during exercise, I imagine.
Exactly. Those muscles that open the larynx, the airway, they don't get the signal when the horse needs to breathe deeply.
Leading to
Decreased performance, you'll hear the breathing, noisy, severe cases, even exercise intolerance.
And those severe cases, grades C and D, that's what this study honed in on.
Those horses where the paralysis is really impacting their life, their athletic potential, that's where this surgery, the VC, comes in.
So walk us through it. Why not just a scalpel? Why the laser? What makes this so special?
Precision, that's the key. Minimally invasive, we're talking general anesthesia, of course, and the laser lets us remove the vocal cord and the ventricle.
The ventricle, just to clarify, that's the
Pouch-like structure above the vocal cord, all on the affected side, usually the left.
Now, removing a vocal cord, that seems counterintuitive for breathing, doesn't it?
You'd think so, but we're not actually trying to restore the vocal cord's function. It's about space.
Creating space.
Exactly, widening that airway. Because the larynx can't open properly with the paralysis, we reduce the resistance that way.
So less about a booming whinny, more about a comfortable, efficient breath. Got it. Now, this study looks specifically at what they called arytenoid stability. What does that even mean? Why is it so important for these horses?
Okay, so picture this. Arytenoid cartilages. They sit on top of the larynx. Little pyramid-shaped structures, right? They're like the gatekeepers of the airway.
Gatekeepers, I like it.
When the horse breathes in, they swing open, air flows through. But with RLN, the left one tends to collapse inwards.
The one on the same side as the nerve that's not working right?
Right, and that narrows the airway. So arytenoid stability, it's all about keeping that left arytenoid from collapsing. The more stable it is, the wider the airway stays, even when the horse is really working.
So how do you even measure that? It's all internal, right?
Endoscopy, so we can actually see what's going on in there. And then they used a measurement called the left to right quotient angle ratio, LRQ, thankfully.
Love a good acronym.
Oh.
But break down the LRQ for us. What is it actually telling us?
So you're looking at the larynx through the endoscope. Those arytenoid cartilages, they look like pointy ears, kind of.
Okay, I'm visualizing.
We focus on the angle between the tips of those ears, the craniculate processes. That angle changes when the horse breathes in and out.
And the LRQ is comparing those angles.
Exactly. The narrower angle when the horse breathes in, the wider angle when it breathes out. Bigger the difference, the more unstable that left arytenoid is.
So they're comparing these images, these LRQ measurements, before and after surgery to see what effect the VC had.
You got it. And this is where it gets interesting. They found that after the VC, the difference in those angles was significantly smaller. Meaning the left arytenoid was way more stable. It wasn't collapsing as much, wider, more consistent airway, even when the horse was exerting itself.
That's huge. But did it matter how bad the RLN was to begin with? What about the differences between the grade C and grade D horses?
Great question, and here's where it gets really cool. The horses with the grade D, the most severe cases, actually saw more improvement in stability after the VC.
Really? Why would that be?
We're not totally sure, but one theory is that because they started with such severe instability, their larynx was almost completely paralyzed. There was more room for improvement, you know?
Makes sense. Bigger problem, bigger potential for a change. Now, no surgery is without risks. Were there any downsides they found after the VC, even with the improved stability?
Well, they did find a slight decrease in how far the left arytenoid could open during inhalation. Less abduction, in other words.
So it's more stable, but it might not open as wide.
That's a good way to put it. We're altering the tissues, the mechanics of the larynx when we do this procedure.
And that could affect how much it can open.
Right, some scar tissue formation, which is normal during healing, might limit that range of motion a little.
How much of an issue is this reduced abduction? Could it cause problems down the line, especially for these high-performing horses?
It's a good question. It depends on the horse, really. For some, especially those not doing high-level work, it might not be a big deal. But it could have implications if they need another surgery later on, like a laryngoplasty, for example.
Because?
Well, with a laryngoplasty, we're trying to keep that left arytenoid open all the time, right? But if it's already a bit restricted from the VC...
It limits how effective the laryngoplasty can be.
Exactly. It's like trying to fully extend your leg when you've got a bit of a stiff knee. You won't get that full range of motion.
That's a great analogy. So we have to weigh the benefits of the VC early on against potentially needing a more involved procedure later.
Exactly. Careful case selection is key. How severe is the RLN? What's the horse's use? What's the long-term plan?
So many factors. It's fascinating how these small details can have such a big impact down the road. Speaking of which, this study was done on sport horses, right? What about other disciplines, racehorses, for example? Those respiratory demands are on another level.
That's a great point. And one limitation of the study, we can't say for sure if these findings translate directly to racehorses.
Because those athletes are operating at peak respiratory capacity most of the time.
Right. The speed, the intensity, it's a whole different ballgame. VC might be helpful for some, but that trade-off with abduction, even if it's slight, it could be more significant for a racehorse.
I can't even imagine.
It'd be really interesting to see more research on this, specifically in racehorses. But for now, big takeaways for our listeners, especially those seeing RLN cases in their practice.
Yeah. What do we really need to remember about all of this?
Well, I think this study shows that VC can be a great option, but we have to be aware of those little details, those nuances.
Like with any procedure, really, knowing the pros and cons.
Exactly. And we saw how much it can help with arytenoid stability, which is so important for airflow, performance, all of that.
That was amazing to see, that improvement, especially in those really severe grade D horses.
Right. But it's not perfect. Like we said, there's that potential issue with abduction, especially if they might need another surgery later.
The laryngoplasty being the big one.
Exactly. So we really need to choose the right horses for this procedure, talk to the owners, make sure everyone's on the same page.
It's always about that individualized approach, isn't it?
Yeah.
Finding what's best for that specific horse. Now, I want to go back to that LRQ measurement for a minute.
Sure, the angles in the ears, right?
Exactly. It's obviously a game changer for figuring out how stable that arytenoid is, but I'm sure some people are wondering what those endoscopic images actually look like. How do we measure that ratio?
Yeah, it's easier to understand if you can picture it. So we're looking at the larynx with the endoscope, and we're really focused on those arytenoid cartilages. They really do look like pointy ears. It's kind of funny.
And we're seeing this from above, right?
From above, yeah, a dorsal view. And remember the tips of those arytenoids, the corniculate processes.
Right, that's what we're interested in for the LRQ.
Exactly. It's like you're drawing a line between those two tips, connecting the dots. And the angle of that line tells us how well the arytenoids are working.
So wider angle when the horse breathes out, that means a wider airway, which is what we want.
Right. Wider angle, good airflow.
Oh.
Now, when the horse breathes in, that angle will get smaller naturally. But in a horse with RLN, that left arytenoid often collapses too much, making the angle way too narrow.
So the bigger the difference between those two angles, the more unstable that left arytenoid is.
Exactly. And that's what's so great about the LRQ. We can actually put a number on it.
No more guesswork.
Right. And what the study showed was after the VAC, that difference, those angles, became much more consistent. The left arytenoid wasn't collapsing as much, meaning a more stable, open airway, even when the horse was working hard.
Pretty incredible when you think about it, how a small change in anatomy can have that kind of impact on their breathing.
It's amazing, isn't it, how these little tweaks can make such a big difference.
Absolutely. Now, you mentioned earlier that this study was done on sport horses. But what about other disciplines? Racing, for example, where they're pushing their respiratory systems to the limit.
It makes you wonder if those same findings would apply.
Would it be the same story?
We can't say for sure, but it's definitely something to think about. The demands on those horses are just extraordinary.
I mean, talk about pushing your limits. Those horses are incredible athletes.
They really are, and that's where those subtleties we talked about with Vinag, like that potential decrease in how far the arytenoid can open, it really comes into play, doesn't it?
Because for a sport horse, a little less opening might not matter as much. But for a racehorse,
every little bit counts when you're talking about those speeds. It could make a difference.
So for racing, it's even more complicated to decide if this surgery is the right call.
Absolutely. It's not just about what's best right now, but what will be best for their whole career. We have to think long term, make sure we're not causing problems down the road.
Always got to keep the horse's future in mind. It's not just about winning the next race.
Exactly.
This has been so interesting. Any final thoughts for our listeners before we wrap up? Especially those who are seeing these RLN cases every day.
I think this study gives us a lot to think about. Being able to really measure how stable that arytenoid is with the LRQ, that's huge. It lets us track those changes, make better decisions for each horse.
It's all about having the information, right?
Exactly. But we can't forget about those potential downsides either, like that reduction in abduction we talked about.
Always weighing the risks and benefits.
Yep, finding that balance for each horse, that's what it's all about.
Couldn't have said it better myself. Well, that about does it for our deep dive into the world of equine larynges and VESI. Until next time, from Vet Neurojar, keep those minds inspired, hearts light, and tails wagging.